Hello friends, today we will discuss diarrhea in ICU. It is defined as having 3 or more loose or liquid stools per day with a stool weight of more than 200 to 250 grams per day or 250 ml per day. Pathophysiology. It includes increased water content of the stool due to impaired water absorption and or active water secretion by the bowel. We call this acute diarrhea when duration is 14 days or less. Chronic diarrhea, also called persistent diarrhea, when duration is 14 days or longer. Infective causes of diarrhea. Acute watery diarrhea. Causative pathogen includes norovirus, adenovirus, enterotoxigenic E. coli. Here, loose stools often mixed with mucus are present, but no blood. Low-grade fever, anorexia are other features. Invasive diarrhea, also known as dysentery. Common causative organisms include Salmonella, Shigella, enteroinvasive E. coli, and others. Here blood or mucus or both are seen in the fecal matter. There is mucosal invasion and inflammation which causes fever. Coming to non-infective causes of diarrhea. Enteral feeding associated. It is common cause of ICU related diarrhea. Etiology include mode of feeding, frequency, composition, contamination, etc. play a crucial role. Every attempt should be made to modify these factors. Next is medication associated diarrhea. Causes include antibiotics, then gastric acid suppressants like proton pump inhibitors, magnesium containing oral medications, laxatives, sorbitol containing compounds, and some oral hypoglycemics like metformin are known to cause non-infective causes of diarrhea. Next is intestinal ischemia, acute mesenteric ischemia. Here risk factors are atrial fibrillation, recent myocardial infarction, sepsis, cardiogenic shock, and others. Other examples are mesenteric vein thrombosis, ischemic colitis. Malabsorptive causes include recent surgical resection, extensive mucosal ulceration, shock, sepsis. Coming to diarrhea in immunocompromised. It can be divided into infectious and non-infectious causes. Infectious causes include neutropenic enterocolitis, seen in patients with severe neutropenia with absolute neutrophil count less than 500 cells per microliter. Other causes include Clostridium difficile and cytomegalovirus. Non-infectious causes include graft versus host disease. Here, persistent watery diarrhea occurs initially, followed by bloody diarrhea, which may require transfusion. Other non-infective causes include chemotherapy-related diarrhea and non-oral mucositis. Stool culture should be done in all patients of watery diarrhea, all cases of dysentery, and in immunosuppressed patients. PCR-based tests are also available nowadays. It is rapid and has excellent negative predictive value. The cornerstone of GI infection treatment is rehydration of the patient. In extremely dehydrated individuals, ringer lactate solution with or without 5% dextrose is preferable over normal saline to repair the potassium losses and acidosis. Other management in ICU include nasogastric feeding. Here, changing the formula feed may help decrease the diarrhea. Medications. You should stop the diarrhea causing drugs. Proactively correct electrolyte derangement. We can use opiates and opiate analogs like loperamide and codeine, anticholinergic drugs, anti-secretory drugs, and protect the patient from perianal excoriation are other management goals.